effects of not taking the medication. And that's a question that people don't usually ask.
Right, of course.
But if you look at the kids who take it, and if you look at the adults who take it, who benefit from it, they won't give that up. You know, they were struggling beforehand.
Now,
and the benefit they get from it is as pronounced as the benefit someone who's nearsighted gets from wearing eyeglasses. So the side effects of not taking the medication in their cases is severe.
Now, you aren't on medication, your children are.
Well, I am on medication. Here it is.
But how do you determine, again, given the difficulty with some of the diagnosis, how do you determine who's going to benefit from medication and who really isn't?
Well, first of all, you take a careful history, you make a diagnosis. Then once you've made your diagnosis, the statistics are 80% of those who have ADD will benefit.
Are going to benefit.
Now, of those, a sizable fraction don't want to take any medication, and I am certainly one who honors that. And one of the reasons in my book I have many chapters devoted to non-medication treatments of ADD is because there's a lot of people who just don't want to take medication, and that's fine. I give them the medical facts about the safety of the medication and let them make their own decision. In my own children's case, they've benefited tremendously from medication, but they also received the non-medication treatments as well, and that comprehensive treatment program gives them it's the golden treatment. It's the best way to go.
What about the other side? I mean, there's reports that up to 50% of kids who are on Ritalin really don't have ADD, and that this is being used often just to kind of suppress normal rambunctiousness in children. It's kind of like a teacher's aid.
Yeah. Again, the data do not bear out.
They don't.
Not at all.
It's an urban legend, old wives' tale.
It's part of this, and again, I don't understand it, but it's part of this tremendous desire to denigrate these medications. No, I'm certainly not here to promote them. In my book,
but that's why we have you on the show.
I go to great length to talk about non-medication approaches, but for some reason there is just this tremendous amount of stuff written about how bad these meds are, when in fact the data support how useful they are. If you add up the number of prescriptions written for stimulant medication and measure it against the number of people who have ADD, you're not getting 50% more prescriptions than people who have ADD. So people just pull these figures out of thin air. Oh, 50% overprescribed. Where does that come from? How did you get your data, sir? Oh, I don't know. It's 50% though.
It's out there.
Yeah, it's out there. I've seen it.
Exactly.
And that is not to say it doesn't get overprescribed. It does. I know it does. I see people who are taking stimulant medication who shouldn't be taking it. And I think what's happening there is what I call pseudo-ADD. There are a lot of kids who don't have enough what I call connectedness in their lives. They don't have family dinner. They don't have adult supervision. They're watching too much TV, playing too many video games. You put kids in that kind of a soup, not enough human connectedness and supervision, too much stimulation with video, they'll look as if they have ADD. They'll be distractible, impulsive, and restless. To put them on medication is a grave mistake.
Right.
You're medicating something that should not be medicated. What those kids need is more human connectedness. What they need is more supervision. What they need is more time playing outside, having family dinner, getting a pet, spending time with grandma, turning off the television, turning off the video.
Well, let's talk about some of those things, because a big part of the book it deals with the non-medical treatment of ADD and how to bring out the talents of people who have ADD. One of the most important things you point out to is finding something you're good at.
Absolutely.
And mastering what that thing is you're good at and getting recognition for that mastery.
Absolutely.
This is part of your five-point program.
Yes.
Why is this important?
Well, what you build a lifetime on is developed talents and strengths, not remediated weaknesses. And I think we in the medical profession have made a big mistake when it comes to mental health in focusing in on what's going wrong instead of focusing in first on what might be made right. Because what you're going to build a lifetime on are talents and strengths that you develop, not weaknesses that you remediate. Now, I'm not saying don't remediate the weaknesses. Yes, you need to do that. But what I want us to start doing front and center, what are your, because a lot of these folks come in, adults come in and say, I don't think I'm really good at anything. And I don't really, not interested in it. So we have to go search
at first. You've got hand-eye coordination going on.
Big deal, you know, big deal. Hand-eye coordination. You know, it is stimulating, but it is intellectually empty. Yeah, I mean, there's no ideas in it.
Diet, things like omega-3 fatty acids, very good.
Yeah, really important. And you know, we've always known that food mattered, but we haven't known exactly what to prescribe. Right. And I have a chapter on what to. Some of it is obvious, like eat a balanced diet. Try to stay away from additives. There's good evidence that junk food is bad for you in general, and particularly bad for ADD. And then a specific intervention. Eat a diet rich in antioxidants, as well as take omega-3 fatty acid as a supplement. And the supplement I suggest is fish oil, because it's very rich in.
So sardines, salmon.
Well, you have to eat an awful lot of sardines and salmon. I think you ought to get a bottle of fish oil.
A supplement.
Yeah, just like Grandma used to give us castor oil. She was on the right track. Now get, but make sure it's high-grade fish oil, because if you don't get the top of the line, you might get contaminants like mercury and other heavy. Yeah.
What advice do you give to someone who has either a spouse or a child with ADD? What's the principal advice that you'd offer?
Learn about it. Learn about it, because as you learn about it, you'll learn how to manage it. Don't despair. Don't think of this as a curse.
Or a prison sentence or something.
At all. Think of it as a gift, but it's a gift that's difficult to unwrap. And what my book tries to do is help you unwrap it so the gift can emerge. Because it looks at first like a curse. It looks at first like, oh my gosh, this person just can't get their act together. This kid can't you know, put his clothes on in the morning, can't get his homework organized, can't sit still at the table, can't go to a party without you know, causing a problem. You can't go on vacation without being so disruptive. And this adult is just a chronic, you know, loser. This adult just loses jobs and breaks up in relationships and drinks too much and gets into arguments, and what a waste of potential. He's got so much going for him and he never will make any use of it. So, okay, it looks like a curse, but I promise you, embedded in that, there is a gift. And if you learn how to take care of the downside, if you learn how to get focused, if you learn how to get organized, and in the case of adults, if you find ways of delegating and compensating and capitalizing on your strengths, the gift can be unwrapped. And that is the whole point of my writing this book.
I've got a magic wand here. I can get rid of your ADD. Do you want me to use it or not?
Absolutely not. I wouldn't.
Honest.
As God is my witness, I would not trade it for the world, nor would I trade it in my children.
Edward Hallowell, I want to thank you very much for joining me. It's been a real pleasure.
Thank you.